Hello and welcome to the Sri Lanka Morning Show. Joining us today is Dr. Thikshana from Officer Family Medical Clinic. Dr. Thikshana, thank you very much for joining us.
Thank you for having me.
I think it's very apparent that you've made time to chat to us today regarding the coronavirus pandemic. Of course, it is impacting every Victorian and every Australian at the moment. Would you mind, Doctor, by starting and giving us a bit of an update on the current coronavirus situation?
Yeah, it looks like it's very important that we have a chat like this today because it looks like we have gone to the second wave of the COVID-19 pandemic in Victoria. It looks like we almost got it under control like a month ago, and since the restrictions were lifted, unfortunately, in the last 2 weeks, we have realized that numbers are going high and high. So it is definitely more complicated than we initially thought, and it looks like with all the effort the government and the people are trying, it's not getting under control. So at the moment there are about 1,800 active cases in Victoria, and the worst part of that is most of the cases we don't know where the infection is spreading, so they are under investigation. And unfortunately, there are about 23 people in the ICU, so they are actually dealing with life and death at the moment. So this is something we really have to think about what we should do to prevent this getting any worse. To give you some more information about how this demographic this distribution is happening, this is commonly spread between young people between 20 years to 60 years. They are the one who are spreading this infection, but unfortunately a lot of deaths and ICU presentations are with the people above 60 years with medical problems. So it is not something we can say, oh, I'm not dying from this, so I'm not going to get very unwell. It is going to be either your mom, dad, uncle, auntie, pop, nan, who are going to die because of what we are doing if we don't really take this seriously. So I think we really have to work hard to stop this spreading, and it's all our responsibility to do this.
Absolutely. Now, Doctor, to avoid complacency, what, in your opinion, are some of the steps that each of us can take to avoid the spread of infection?
Yeah, so this is something we have spoken for the last almost 5-6 months. But the gold standard theory behind stopping this spread is, unless you really have to get out of the house, please stay at home. If you keep going for every bit of thing, even yes, we are allowed to go shopping, but if you have to go every day to buy one thing and another thing, it is still not, we are not doing the right thing. So we have to make sure we stay at home unless we really have to go. But saying that, yes, we have to go out for certain things, important things. The government has allowed us to go for 4 main things: for work, for studies, for exercises, or to look after somebody who need help. So medical help or some caring. So if you have to go for something like that, then we have to make sure we maintain the social distancing. So the guidelines are we have to keep 1.5 meters apart as long as we can. In the past, like when this first came and it was not that pandemic at that stage, we thought we don't need to wear masks to prevent the spread. But with latest findings and the fact that it's spreading so hard, now we have decided if you can't maintain the social distancing, you have to wear masks. So that is a new thing that we did not practice in the past, but it is something we are practicing now. So people should be aware that we should wear masks. If you are going public transport, if you are in a supermarket with more people, better to wear the mask. The other most important thing is the hygiene. So you have to make sure you make sure you wash your hands all the time, either with sanitizer or with soap. And when you're sneezing, coughing, please cover your mouth. We don't want to spread it through everywhere. And the other most important thing we all have to practice nowadays is, even if you have the slightest symptom, sore throat, cough, mild fever, headache, please go and get tested. Okay, we can only stop this spreading by knowing who has it and who don't have it. We can then go through the people who have been tested positive and find out the source of the infection, and we can stop that spreading. So it's very important that we get tested and let the government know how we got it. So they will do everything else. If we get tested, we can stop this spreading. The other most important thing we can do is to get the COVID Safe app that will guide us to tell who have been in close contact with us at that moment. And with the development of the app, now we can even go forward for after 14 days. If they found somebody has got the virus, they can still let us know to get tested, because that is the way we can see if we have got the infection. So these are the things we can do to prevent this spreading. So it's very important we stick to these advices and we all practice as a country and stop this spreading.
Now, Doctor, I know this is a bit of a tricky question, but in your opinion, how do you feel that the virus has spread recently with these growing numbers?
Yes, so of course, as I explained, these are the guidelines and restrictions given to us. I think everybody's trying their best to stick to the guidelines, but I think with the latest increase in numbers has a lot to do with families getting together a lot more than they have done before, since the restrictions were lifted. With the information and the data we have been given so far, I think a lot of communities have decided to get together and meet their family members. And of course, as we know, especially in our cultures, and when we meet, we go and hug, and we share things, and we feed the grandkids, we feed the elderly people. So this could have been the reason that this spreaded this fast in a short period of time since the restrictions were lifted. So we have to understand there are so many elderly people in our families who are basically sitting at home, not going anywhere. But if you don't stick to these guidelines and prevent this spreading, they are the people who are going to even lose their lives without we intentionally not doing anything. We love our family, but we could be doing the harm by going to these places and hugging and kissing these people. So this is something very important, as I know a lot of Sri Lankans and our people is listening to this. So we all have to stick together and make sure we do not go to see our elderly people or sick people and get close to them, because we could be the people who are spreading the infection.
And Dr. Thikshana, other than our elderly family members, are there any other members of the community who are particularly vulnerable?
Yeah, so people with, according to the data, people with any heart conditions, lung conditions, diabetes and chronic renal failure, cancer patients, their immune system is not as strong as they think. So what happens is, because we don't have a treatment for this virus, when they get the infection, they can't fight by themselves. So they are the people who ended up having pneumonia and lose their lives. So they should be more careful getting close to, even if they don't have symptoms, to their family members and getting close to them and get the infection. So they have to be really careful if they're having any underlying medical problem.
Now, you spoke a little bit earlier about people getting tested. Now, what exactly are those practical steps for people when they do have a bit of a cough, a cold, maybe a sore throat? What should they be doing?
So ideally, it has to be a nasopharyngeal swab. You have to go to a place where they do the nasopharyngeal swab. It is because this program could be listened by many people in Victoria. So every place, every suburb or the area has different ways of getting tested. In hotspot areas, there are a lot of drive-through places. In other places, there are fever clinics. In some suburbs, doctors' practices do it. So because of this complexity and different ways of getting tested, my advice is the people should ring their GP. You can have a telehealth conference and talk to the GP and ask how to get it done. Or even if you ring the clinic, most of the receptionists are aware of the areas or the places that they can get the test done. I advise they should ring the GP clinic and ask them where they can get the test done.
Now, Doctor, I'm sure you can agree that these are really challenging and unprecedented times that we're living in at the moment. Now, I know that there are many members of the community who are feeling quite isolated at home and dealing with mental health challenges, social anxiety. What advice do you have for people I guess so they can cope and make it through these challenging times and come out, you know, somewhat put together on the other side.
Yes, yes. So this is it's actually becoming a big problem as this is getting prolonged and prolonged. This socialization is really affecting our community. First of all, a lot of people have lost their jobs, and then there's another group of people who are not sure whether they're going to lose the job or not. And then, of course, the kids are at home. Parents are supposed to do homeschooling, and then there's a lot of restrictions where they can't even go and get things done. Of course, we had this crazy buying situation where people could not buy their own things because the supermarkets were empty. So all that has created a lot of stress, anxiety, depression to people where they don't know how to cope. And of course, the fact that even though the family members love each other, but when they are staying in a house the whole 24/7, they could be getting into arguments and issues, especially with young kids. There has been even family violence happening a lot more than usual. So we have thought of that from the beginning. I think the government has invested so much money on mental health. There are institutes like Beyond Blue, Black Dog. They have to ring and get help. At the same time, GPs are well trained, and we are very dedicated to speak to our patients, because I know more than anything, patients trust their GP so much. So my advice is, if they don't feel right, if they think they're getting lost or they are getting angrier or they are getting agitated than normal, they don't enjoy the things they used to enjoy before, best thing is to give a call to the GP, either telehealth or face-to-face, and just come and have a chat. I know, especially with our community, it's like a stigma. We just don't want to tell anybody that we are not coping. So I think that time is over, because if you can't bottle up so much, because we don't know when this is going to end. Hopefully this will be finished very soon, but nobody knows when. So it's better to be more prepared. If you think you're not coping well, please come to the doctor, have a chat to them. We are fully trained and we have done this job for a long time. We can definitely help the patient as well as their family members if we think they are struggling. At the same time, in terms of financial stresses, some people don't know they are given a lot of support by the government. So if you don't know if you're eligible for some grant or from support, please talk to your accountant. They should be able to give us more information. So rather than just thinking and worrying, it's best to talk to the doctor, talk to the accountant, talk to the family members, talk to friends, and get more information. We could be more prepared for this situation if you know more information.
Dr. Thikshana, thank you very much for joining us today. You have definitely given us some practical tips to cope with these very challenging and dire times. And I urge any of our viewers out there to go and organise a consult with Dr. Thikshana.
Of course, or any doctor, yes.
Or any other doctor. Dr. Thikshana, as I mentioned, is at Office of Family Medical Clinic.
Yes.
Thank you very much for your time.
Thank you very much for having me.